Welcome back to Face to Face. I'm John Ralston. We're continuing our look into the practice of cosmetic medicine here in town with a doctor who went from being a family practitioner to mostly practicing cosmetic medicine. As I mentioned earlier, Dana talked to a fairly prominent cosmetic surgeon, Julio Garcia, and about his concerns about doctors such as yourself who abandon their specialty to do this. Here's what he said.
Average plastic surgeon's medical malpractice is 9 to 10 times what a family practice doctor's is. So there's reasons for that. You know, we do procedures that are more complex. We do more procedures that can, arise in complications.
Yeah, common sense tells me that people are often unsatisfied or minor things can go wrong that can turn into major things with that. The medical malpractice crisis in this state has been well documented. I'm sure that you knew about that when you were a family practitioner. What about what Dr. Garcia says now? Have you had to increase your premiums? Has that become a problem for you?
It's funny you mention that. Really, it wasn't an issue when I first began doing this because it started cascading as more and more people started coming to us.
You didn't expect it to get as big as it has.
Well, we were encouraging it, but we didn't expect it to take over. I thought it was 80% of our income is cosmetic or other things that we do, and it turns out our primary care side is only about 12% of our gross income right now. That means 88% of what we do is other things, primarily cosmetic. So that was really not anticipated, but it came of itself. Our patients started sending other people, and our patients started coming back. So it grew on its own. So I did not anticipate that. Now, what Dr. Garcia was saying, I really think you should do what you're qualified to do and capable of doing. And again, we don't expect perfection, but we try to get a very high rate of success and very few issues, and the more you do, the better you get at it.
But and you can maybe I'm missing something here. But now that this is a huge part of your practice, don't you have to tell the insurance company, look, we're doing this, and doesn't that change your malpractice premium?
About $2,000.
About $2,000 a year?
Yes.
That's all it changed?
Yes.
Wow. They must have real confidence in you, huh?
Well, I was not happy about the $2,000, frankly, John. No, I tell them how much I do, and I was amazed that they actually increased my rates about $2,000. And let me explain why. When we see a medical patient and they've got chest pain, shortness of breath, the risk is phenomenally higher than a little bit of Botox. You and I know that.
Right.
Okay, or if you put in a spinal tap, it's much higher. You're talking about a little Botox needle here, okay? And the Botox will disappear in about 3 months. It's not a permanent thing. And you're talking about a minor injection. So this is not brain surgery, and this is not putting in breast implants or any...
well, you're actually making the case that maybe a medical assistant, maybe I could do it if I just had a couple courses. I could go stick a needle in somebody, no?
Well, I think you could. But
really?
But the question is, should you be doing it? And then also, at some point, you have to draw the line and say, well, you have to have this kind of a background. And I don't know where that line is right now.
And clearly the legislature has not outlined that, as Benjamin Rodriguez and others said 2 years ago they should. Let me just ask you a question. I hope you'll answer this. How many people do you inject on an average day?
Well, we ran some numbers, and we're averaging probably about, I would say about 900, with strictly Botox and Juvederm, probably about 900 treatments per year currently. Now, that doesn't include everything else we're doing. That's only the Botox and Juvederm injections. Now, if you add it out over all the years we've done it, we're into the thousands of treatments. And
there's a huge profit on each of those Botox shots, isn't there?
Well, you'd be surprised.
Really?
Absolutely. Now, remember, when I first started doing Botox injections back probably in 2003 or so, 2002, the price per unit was approximately $12 to $14 per unit, and that's how it's priced. Botox comes in a little bottle, and you have to mix some water in it. And so to go apples to apples, you have to figure out how many units you're injecting, which is the active ingredient. So what's happened recently is the cost of buying each unit has escalated, and the reimbursements have dropped because it's becoming very competitive.
We're out of time. Dr. Lee, I really appreciate your willingness to come on and talk about this subject. Thank you. And good luck to you in your practice. All right. And on the next Face to Face, more of the issues that matter to you from people in the know, only on Las Vegas 1.